Today we'll be discussing polycystic ovarian disease. Now the polycystic ovarian disease, it is a multifactorial disorder seen in the young females, and it is associated with irregular periods, infertility, abnormal weight gain, and features of androgen excess like hirsutism, alopecia, and weight gain. This disorder is increasing day by day because of the environmental factors, and sometimes there are inherent metabolic disorders and immunological disorders also associated with this disease. PCOD these days, the incidence it has been seen is around 1 million cases in India per year have been recorded. These patients, they are diagnosed basically on the basis of the ultrasound along with the clinical signs and symptoms. PCOD is increasing day by day because of the change in the lifestyle, because of our eating habits, because of the sleep habits, and because of the diet, abnormal diet intake. It is a chronic annuity disorder. It is a chronic disease which is a matter of concern. So far there is no permanent treatment for polycystic ovarian disease. However, we can cure it to some extent. The women come to us with a history of irregular, delayed, or absent periods for a long time, and along with the history of abnormal weight gain, they may be having insulin resistant symptoms and along with increased sugar levels. Long term, if a PCOD is not taken care of, it can result in type 2 diabetes mellitus, and there's also history of CVA and cardiovascular disease in the long term if it is not treated well on time. Whenever any girl comes to us with PCOS, she has to be evaluated with laboratory tests plus ultrasound, and early therapy and treatment is to be started at the very outset. The treatment in PCOD is a good and healthy lifestyle and good and healthy dietary habits. A female with PCOD should cut on her sugary diet, avoid oils and fats, and easy packed and processed food is not to be allowed. There should be increased fibers, and the ratio of the carbohydrates, proteins, and the fats should be in the ratio of 60 to 30 to 20. This is the ideal diet which takes care of PCOD. We have to look that the patient should take less of salt in her diet, it should be less than 5 grams. At the same time, look how much oil you're consuming. It should be almost 1 teaspoon in a day. Avoid sugary drinks like the cold drinks and coffee. Cut on this. At the same time, good healthy routine is very important, like a brisk walking or swimming or cycling. So these things, they work in PCOS. So at the same time, stress is to be avoided and sleep habits have to be improved. The patient should get up early and avoid staying till late. So the actual sleep schedule should be somewhere 8 hours of rest in the night, which helps in bringing a discipline in the life, and this to some extent helps in curing the PCOS. These are the basic modalities which we recommend for a PCOS patient other than the medicines that we give for PCOS patients. So we are here to increase the awareness of this PCOS so that we can do some lifestyle modifications to prevent the allay and development of other complications which can ensue if it is not treated or cured in time. Thank you.